figure out by now. Oh, you got your pictures on the wall, got your posters on the wall, got your problems on the wall. All your problems, all your problems, all your feelings. We're supposed to care somehow. Oh, you got your pictures on the wall, got your posters on the wall, got your problems on the wall. Yeah, all your problems, all your problems. We're all working harder, waiting for a good chance to get a little distance farther, waiting for a good chance to be another victim or martyr. Say anything to get me out of here. Working harder, waiting for a good chance to get a little distance farther, waiting for a good chance to be another victim or martyr. Say anything to get me out of here.
I think we're live. All right. It's going to be a heck of a night because one, the baby's going again. It just seems to be the timing of things. But two, I am serious when I said we're dismantling the government narrative on COVID tonight. I sat down. I wrote out we're going to change up our live streams from here on out. We're getting serious on these things. That's the schedule. I know everything we're doing, and we're going to hit it right away as soon as my wife's ready. But on this, you might have noticed we didn't write an article today. I am working on something we'll touch on here in a minute. Again, I apologize, but the producer has a baby. But I'm starting to do research on the IBCK, International Bank of China. And basically what I'm finding is some concerning things going on with some of the SWIFT codes and different things that the bank institutions are using. And it appears that based on what I'm seeing in the SWIFT codes is that RBC, CIBC, and banks like that appear to be set up to take funds or at least do transfer of funds directly from China. Now, one of the things I've noticed, thank you, greetings from Vancouver Island. Thanks, Wes. Good to see you. One of the things we know, or I've noticed when I was looking through these things, is that what we've allowed is the Bank of China actually has places in Toronto and in Vancouver and Richmond that can essentially give out bank loans directly from China. So we're allowing direct Chinese assets into our country. And I have not seen what China is doing on Twitter. But let's pop in here. You ready, Kate?
Yep.
All right. Sorry. So this is what I'm talking about. Industrial and Commercial Bank of China. Oh, there it is. Industrial and Commercial Bank of China, Canada. So this is what I was talking about. Home mortgage loans, all done out of the Bank of China. This is what they offer. Home mortgage loan, term loan, secured personal line of credit, car loan, RRSPs. And basically what I've run into is that they make the language so convoluted to understand the reverse bank bail-ins. I'm trying to understand how the reverse bank bail-ins might play into this. But either way, to allow a Chinese bank in Canada to give out money, even home loans, is absolutely nonsensical. What are we doing? So I want to go here. Is this the one? Here it is. Banks, routing transit numbers, SWIFT codes, okay? You can see in here, we have the Industrial and Commercial Bank of China, Canada. This is what comes up under that search. We have Industrial and Commercial Bank of China, Canada. These are the codes. Industrial and Commercial Bank of China, Vancouver. That's Toronto above. Bank of China, Mega Commercial. So this is all available in Canada, everyone. Richmond, Mega Commercial International Bank, or Mega International Commercial Bank. First Commercial Bank. Now we start getting into the ones that are actually Canadian banks. IC Bank Canada, Laurentian Bank of Canada, Bank of Nova Scotia, Royal Bank of Canada, Royal Bank of Scotland, Korea Exchange Bank of Canada. Now, some of these I think are just currency exchange, but either way, I don't think we should be making it more convenient to trade won, which is what they want because they want to debase the dollar as the world reserve currency. So I'm looking into that. It's a hefty one to go through, as you can see, and I have to do a lot of understanding the terms in behind if I'm going to do a good job on that, so it's going to take a little bit. Oh, where'd Broderick go?
I think he's trying to come back in.
Oh, okay, so we lost him. Okay, so we're going to get right into it. I'm probably going to get a little fired up tonight. I said I'm done. Enough, okay? Absolutely had enough of the lies from our government claiming to care about the Canadian people. If they cared about the Canadian people, they would make it known what is actually going on. It wouldn't be difficult to find all the information. It wouldn't be a pain in the rear end to get to the bottom of things. Now, we're going to go through FDA documents. We're going to go through CDC documents. We're going to listen tonight from the founder of the PCR test himself, Kerry Mullins. We're going to listen to Dr. Anthony Fauci tell us that anything ran at over 35 cycles is only picking up dead nucleotides, likely can't even be cultured, and more. My latest article, we went through the public health documents, and we went through, and it's one thing to hear something in a meme on Facebook. It's one thing to see it somewhere on Twitter, and you think maybe that, it sounds like true information, and they'll say it comes from here. But if you don't source things these days, nobody's going to believe you. So we went through, and I did this article, and we sourced everything, okay? The whole conspiracy of these different things we keep hearing, not conspiratorial, and I'm going to point to all the documents to lay it to rest tonight. I'm done. Enough is enough. Enough is enough. Stripping away our freedoms. Oh, you can take it up in the courts, but the courts is going to be 2 years before you're maybe even heard. That's where we're at. Hey, I know you want, it might be a grotesque abuse of your rights, and you can take it up in the court, but for now, shut down your business and everything else and hope for the best. Enough. We debunked the narrative tonight, and I'm going to do it from all the documentation itself. We're not going to play around anymore. I've got everything lined up, so invite your friends in, especially the skeptical ones, and let's go. First things first, screen share. Okay. Starting with Kerry Mullins. This is the creator of the PCR test, and this is him being asked about the test itself, and we're going to listen to a few minutes here, and I think you'll understand why you need to hear this. The creator of the PCR test, the test that is not at all designed to diagnose even HIV, a more rare disease, as Kerry Mullins will talk about. So why in the heck are we using it for COVID? Let's go.
I want to ask this to Kerry. How do they misuse PCR to estimate all these supposed free viral RNAs that may or may not be there?
I think misuse PCR is not quite. I don't think you can misuse PCR. Actually, the results, the interpretation of it. See, if you can say, if they could find this virus in you at all, and with PCR, if you do it well, you can find almost anything in anybody. It starts making you believe in the sort of Buddhist notion that everything is contained in everything else, right? I mean, because if you can amplify one single molecule up to something that you can really measure, which PCR can do, then there's just very few molecules that you don't have at least one single one of them in your body, okay? So that could be thought of as a misuse of it, just to claim that it's meaningful. But
what was that, Kerry? It could be thought as a misuse to claim it was meaningful. It tells you something about yourself, but it's not really. Okay, let's keep listening.
The real misuse of it is that you don't need to test for HIV. You don't need to test for the other 10,000 retroviruses that are unnamed also in the subject. See, somebody that's got HIV generally is going to have almost anything that you can test for because they have definitely been. HIV is a
And it's the same with coronavirus. As I'm going to point to tonight, I have shared a document on Diverge Media's page. If you haven't shared it yet directly from the FDA, you need to share it because we are doing something. The coronavirus has not been isolated using the known scientific method. I will point to the CDC document after. But we are picking up other viruses as well. So when Carrie says it can pick up other things and it can be misused, verbatim what's happening with COVID.
Fairly rare virus. There's only 1 million of us out of 250, 300 million people in America that have that virus. So you have to get around. Either your mother had to have it and pass it to you, or you have to really be paying a lot of attention to people that do have it and paying only attention to them and get a pretty good chance of getting it that way. It's hard to get it. But if you have it, there's a good chance you've also got a lot of other ones. Because you've been in the market for it's been possible for you to get a lot of. To test for that one and say that has any special meaning is what I think is the problem. Not that PCR has been misused. It's like it's not an estimation. No, it's a really quantitative thing. It tells you something about nature and about what's there, but it allows you to take a very minuscule amount of anything and make it measurable, and then talk about it in meetings and stuff like it is important. See, that's not a misuse. That's just sort of a misinterpretation.
Stop. Does that sound like a guy who would recommend this be used to diagnose a, quote, pandemic? It allows you to amplify minuscule amounts and make it seem like it's useful and stuff. Okay, Carrie Mullis, the creator of the PCR test, laying it out for you, everyone. Not Greg Staley from Diverge Media. Carrie Mullis, the creator of the PCR test.
Even after all these PCR, this quantitative PCR, that if you just get down to a basic virological count, it's still 1 in 1,000 to 1 in 10,000. HIV in 1 to 1 in 1,000, 1 in 500 to 1 in 1,000 T cells.
It is. No, there's very little of what they call HIV, and what's been brought out here by Philpott and Isai already. The measurement for it is not exact at all. It's not as good as our measurement for things like apples. An apple is an apple. You know, you can get something that's kind of like, if you got enough things that look kind of like an apple and you stick them all together, you might think of it as an apple. But and HIV is like that. Those tests are all based on things.
And coronaviruses are like that. You know, you stick you might stick them all together, might look like an apple. That's just what he's literally saying about a more rare disease than coronavirus, everyone.
That are invisible, and the results are inferred in a sense. PCR is separate from that. It's just a process that's used to make a whole lot of something out of something. That's what it is. But it's not. It doesn't tell you that you're sick, and it doesn't tell you that the thing you ended up with really was going to hurt you or anything like that. That's what it's not.
Well, thanks, Carrie. Thank you. I think you cleared it up pretty good. That's a good start, everyone, isn't it? Welcome back, Broderick. Greg ranting. This is going to be a great stream. Thanks, Glenn. I'm a little pissed tonight. Okay. All right. So, I said Fosse next. Here we go. Anything over 35 can be misused. Is this the one? I think this is the one. From our article, Exposing the COVID Narrative, Setting the Record Straight. The video is included in the article. Here we go.
Right. Again, a good question. And what is now sort of evolving into a bit of a standard that if you get a cycle threshold of 35 or more, that the chances of it being replication competent are minuscule. So that if
you get it 35 or more, the chances of it being replication competent, meaning can infect others, are minuscule. For the record, if you've seen our test, anything over, we run 40 across the board in Ontario. So anything over 35, according to Fosse, is crap, okay? We run 40 as the baseline. So when people say false positives, they're talking about a false positive? No, because we run at 40, you can have a legit positive that doesn't mean shit. Okay? Just because you test positive here in Ontario does not mean a darn thing.
I've been trying to get it.
And you know, we do.
Oh, sorry. Sorry. Go ahead.
I can't speak with your screenshot on that goes.
Oh, okay. Well, we'll get back to it. It's a 50-second video.
We
Here
have
we go.
patients, and it's very frustrating for the patients as well as for the physicians. Somebody comes in and they repeat their PCR and it's like 37 cycle threshold. But you almost never can culture virus from a 37 threshold cycle. So
We run 40.
If somebody does come in with 37, 38, even 36, you got to
We run
say
40.
it's just dead nucleotides, period.
Just dead nucleotides, period. Thanks, Fossey. So we've heard from 2 experts so far tonight. Oh, 2 experts. They sound like they're advocating for the PCR test or not. I don't know. What do you have to say?
What I was
Sorry.
gonna say earlier was, so we have 1 positive test in my workplace. So one of my coworkers was like, "Oh, I'm gonna go get tested," and I'm like, "Don't go get tested." And he's like, "Why?" I was trying to get through his head, right? Don't get tested because it's fraudulent. Like it's just straight up fraud. And I'm like, if I get told to get tested because my coworker who works closely with me gets a positive, I'm gonna tell them to go truck themselves, and I'm gonna stay home for 2 weeks or whatever I have to do. But
I mean,
2-week vacation would be nice. Probably not. No.
I said, like, I am freaking done. Send this to all your friends who don't, they're buying the narrative hook, line, and sinker. Because I am not going to show you a single thing tonight. That's my opinion. They're all going to be sourced from the FDA, CDC. That's how we're going to rickety roll it. Okay? Because this has to stop. Stripping away freedoms, destroying the economy, poverty's at record highs. How many children are at risk of starvation because of this? I get emotional. I'm watching my future, my kids' future slip away. For what? Based on what? Based on an absolute fraudulent test. Based on absolute garbage. And in my article, I point out the fact, why do you think the NFL's not getting positive tests like crazy when they're near each other, close contact, sweating, beating each other up in pads and equipment, working, living close to? You want to know why? Because they're not running at fraudulent levels. And they have a much more rigorous set of things to do to confirm a case. And that's still with a fraudulent test that I wouldn't use to diagnose anything. But here we go. Alberta is 35. Well, there you go. He's right at the threshold there in Alberta. Okay, so, got to go back here. Okay, our Facebook page. Please share this out. It needs to be shared, but I'm going to show you from the document itself because, nobody believes you if you show them a Facebook post these days. So this is the document. You can share, but this is where it's from. Okay, page 37. What is this? FDA.gov. Okay, CDC 2019 novel coronavirus real-time PCR diagnostic panel. Down to page 37. Oh, I can't even believe I'm doing this. Why isn't the media doing their job? Can anybody answer that question? If the virus mutates, not that one. Test performance can be affected by the epidemic, not that one. Detection of viral RNA may not indicate the presence of infectious virus. Okay, here we go. I'll repeat. Detection of viral RNA may not indicate the presence of what? Meaning infectious virus. Meaning it doesn't necessarily prove you can infect anyone, even with a legit positive. So why are we forcing people into their homes? Why are we forcing people out of the workplace? Why are we doing all these draconian measures that destroy the economy? I'll continue. The performance of this test has not been established for monitoring treatment of COVID-19 infection. What? The performance of this test has not been established for monitoring treatment of the 2019 nCoV infection. Next, the performance of this test has not been established for screening of blood and blood products for the presence of 2019 nCoV. This test, this is the one. This is the mother, okay? This test cannot rule out diseases caused by other bacterial or viral pathogens, everyone. What does that mean? When I said Carrie Mullins was talking about HIV could pick up other things? Yeah, no, this is picking up other things too. And I will tell you how it happened because I looked up the study myself. Well, we isolated the virus. You didn't isolate shit. What they did is they took 9 people that they said same symptoms, and they tested them and they said, yeah, it was pretty close match, and that's what it is. So they've left open, as you can see from this FDA document itself, that it can pick up other viruses. Now, insert 40 amplification cycles or 35 or whatever else. And what I will tell you is from our article directly, anything over 24, according to the literature, I repeat, anything over 24 cycles could not be cultured to prove its infectiousness. Why are we doing this? I will go on. CDC, not yet. I'm sorry, I'm getting ahead of myself. Is this the one? No. It's in our article.
Saying, Quebec is 45.
Quebec is 45? Are you freaking kidding?
Right?
And that's where the most cases are coming
more
from.
Than, yeah.
Yes. No, we'll go into this. No stone will be left unturned tonight. If you think I missed something at the end of it, kick my comment section. Tell me what it was. Here we go. Nobody believes you though. This is another. What's this? FDA.gov. Begad.
Do you just what?
This is in our article, How to Fake a Pandemic. When did we write this one? We wrote this on October 27th, everyone. October 27th. Wow, it's almost like I've been saying this crap for a while now.
The months have been flying by.
Page 39. Since no quantified virus isolates of the 2019 nCoV are currently available. What? Since no quantified virus isolates of the 2019 nCoV are currently available. That basically means what? They have not isolated the virus. Sorry for your friends out there that absolutely it is 100% a real thing. I don't know. I can't tell you for sure, but where the hell the flu go and it hasn't been isolated known scientific method? Does that mean it's not a real virus? No. Does that mean it's maybe not a new virus? No. But it means that they haven't properly isolated it at the same time the flu disappeared. 39 was the page. There we go. Oh, too far.
You don't have a scroll wheel in there?
Well, yeah, I do have a scroll wheel. So just because, nobody believes you if you show them from an article, hey, you're a new company, I don't trust that. Me. FDA.gov. Since no quantified virus isolates are currently available, assays designed for detection of the nCoV RNA were tested with characterized stocks of in vitro. Yeah, big fancy way of saying they took what they thought was the virus and said that's now the virus. But as you can see from the FDA.gov document itself, since no quantified virus isolates are currently available. 07/13/2020. How we doing? Good start?
It's like a bombshell already.
We're not even getting started yet. Other issues with testing. Directly from our article. I'm going to pull up here. Sorry, everyone. As I said, no viral growth was observed in samples greater than 24 or symptom onset day greater than 8 days. This means no viral growth was observed in the 90 test samples that were collected that ran at a cycle threshold of more than 24 cycles. Okay, continue. Cycle difference between labs. Where is it? Here it is. Man, this just frustrates me. I'm so angry. I'm so done with this. Depending on where you tested, you could yield two different results, everyone. In April of 2020, IQMH, the Institute of Quality Management in Healthcare, sent a proficiency testing panel to 26 different testing laboratories in Ontario who reported the following. Variability of cycle threshold values of up to 8 cycles were observed for the same specimen tested across the participating laboratories. What does that mean? 26 different labs, 8 different cycles difference, meaning you could have been 8 lower, not tested positive, and over there you take it at a different lab and you test positive. Does that sound like a system that's A-OK to everyone? I'll continue. The Institute of Quality Management and Healthcare, IQMH, is the organization that administers the quality management program for laboratory services in Ontario. Fruity and slip in this, if you're able to catch it, cycle threshold cutoffs cannot be reliably used for the determination of virus viability. What is viability? Well, I'll put it another way. Cycle threshold cutoffs cannot be reliably used for the determination that a virus is able to grow, live, and develop. Meaning what? Infect other people. Meaning we can't, if there's a down here, we can't say it. We don't really know. It needs to go to a lab like we did in the early days, like we did when we covered our article. The joke that is COVID-19 testing. They used to send it to the National Microbiology Lab in Winnipeg. I think it's Winnipeg. Okay. And they had to prove it could infect another cell. And that was a true positive. And now they've just changed the game. And whatever, we're going to change the definition of what a case is and all this fun stuff they've been doing behind the scenes. But your fear was still up. And so you just, you missed it. Okay, what else do I got? Different assays are used which can yield different results. In a complex laboratory, network environments such as Ontario, where specimens may be tested at one of several laboratories greater than 40, meaning so 40 is the level they told me. This says, according to this Public Health Ontario document, some of the laboratories are actually running above 40. Okay. In the province of a variety of different extraction PCR platforms, utility of such questioning is reporting is questionable. Moreover, test results are received by and reviewed by a myriad of healthcare providers as well as patients with varying understanding of CT values, meaning different people are misinterpreting these things, maybe not trained to understand what they really mean. Where's that from? Public Health Ontario, all linked here. I'm not spoon feeding this all tonight. I don't got time. Documents go on to say that false positives are rare, but we must keep it fresh in our mind what a positive case is. And it doesn't mean much of anything based on the available literature that stated, we just read above, no viral growth was observed in samples with a cycle threshold greater than 24. We run 40 plus, everyone. 35 is the lowest, I think, is just what I said. That's Alberta. I don't know. I focus on Ontario because it's, that's where we are and it's the bigger province. And we got a lot of the cases here, so it's just easier for me to do. Now, what does the NFL do? I believe they run at 25, although I'm pretty sure the Goodell interview where he said it has been scrubbed completely from the internet because I remember him saying that. But regardless, here's what I actually found. Let's go into the NFL. The league, Shattles explains, had well-defined testing protocols in place since the season began. When an athlete or staff member tests positive on the PCR method, notice they say the PCR method. Why is that? Because they use other methods too to confirm it. The league does not hit the panic button. Oh, imagine that. You got $1 million assets. You don't hit the panic button every time you get, positive. Instead, the NFL, after being confronted with an initial positive test, continues to follow up with 2 more tests and a nasal swab to be tested in a lab as well as a point-of-care test. Now, Dr. Sills, the man in charge of the protocols for COVID in the NFL, had this to say following positive test on 77 individuals. 77 individuals tested positive one day, which included 44 players, 33 staff members across 11 clubs that were all associated with one regional lab. Suffice to say, Dr. Sills explained these are not really sensitive, delicate tests, which again are subject to irregularities of this type. Irregularities, 77 individuals. Now, if this wasn't the NFL, that's 77 people who are losing an income. That's 77 people who got to figure out plans for the kids potentially. They got to figure out what they're going to do. What's that? They're sensitive. Big whoop. Yep. Keep on. Keeping on. The key for us and our testing partners to quickly recognize that. And that's what happened here. The medical team immediately snapped into action. Come to find out, all of the positive tests were a result of what? Cross-contamination within the lab. 77 cases, cross-contamination, one day. Has anybody else seen that? Was it the UK and they're handling every vial with the same set of gloves, wiping it with the same wipe, dumping it in the same basket. And then, they had like 1 out of 12. It was an undercover journalist said their 1 out of 12 was leaking. And then they're just throwing that all in the same container. Oh, that can't be a big issue, can it? Yeah. 77 false positives, one lab. These are the type of follow-ups that Ontario's doing. Very unlikely. Now, where are we at? I got to go back to here. Different assays, transport. How was it handled? How was it tested? What was their training of the people handling it? This can all affect. Now, Inexperience can lead into that. We have people that aren't really are really trained to take tests and do the lab work that are now doing the lab work because, quote, we have a pandemic on hand and we got to get all the testing out of the way. Well, just get it done. And we'll see at the later on in the show tonight, that we are running triple the testing that we did at the beginning of the, quote, pandemic. Now, that's my next part. I literally got my next part. Sorry. Here we are. Spikes. No. Nope. Testing volume. Passed it. They just make it so appealing. Where'd it go? Test completed. Do you see? This doesn't do it justice, everyone. But you can see. Well, let's go table. Okay. 53, 58, 55, 39 is down day. You got to throw a down day in there every once in a while. Keep those false positives down so that you can just, play the game. Okay, 23, back to the, quote, peak of the pandemic beginning. April 16th. This is literally week 13 from our Where Did the Flu Go article. Same time COVID starts to spike. The flu just disappears off the face of the planet. Yeah. 9,001. 12,000. Let's go. 10,000, April 25th, May 1st, 16,000, May 4th, 14,000. Let's keep going for it. Oh, you just see the graph. Oh, back down. I wonder if our cases drop down then. Probably. This would be a good way to coincide the data and see what's really going on, everyone. If people want to help Diverge Media. Yeah, it's like a wave. It's almost like every time they get a spike, they come out and say, hey, you're a piece of garbage. Stop going out. All of a sudden, they drop the testing. And then, back to and back again. So let's keep going. Look at the increases slowly but surely coming up for our.
Is this Ontario?
This is Ontario. Okay,
I don't send this link off to me.
Like now
or later.
You wait your turn. Yeah, I'll send it to you later.
Play around with it and with some data and see what I can do with it.
Yeah, there's also raw data available on this website. They just make it an absolute pain in the to do anything. So, okay. We're up to August.
I can make graphs out of that.
Yeah. And you see, we floated around the 20 to 30,000 mark for a long time. And now we're getting back into all of a sudden, when was it that we started to come into? They said the second wave, probably mid-September? Oh, look at, they increased the testing. Wow. It's almost like this is a pandemic. It's almost like this testing allows them to cause spikes whenever they want. Now, I'm being pretty bold with that assessment, but it's because I backed it in multiple articles at this point, from the public health documents, from the FDA, from the CDC. How much more do we need, people? Oh, let's keep going. Oh, it drops down. Oh, okay. Where are we at now? Oh, it's dropping down. No, okay. Right before Christmas, what happens? Oh, let's increase it again. Oh, November 20. Oh, look. 36,000. We started talking about lockdown, I think, around this time. Oh, let's just ramp it up. Oh, we got too many cases. Oh, now we're going to start talking about taking away Christmas. Okay, November 20th, 48,000 tests. And then 46, 37, 27. You got to drop those cases. Or maybe they're backlogged. Who knows? Whatever freaking excuse they want to use of the day. 47, 58, 55, 53. Are we seeing what they're doing yet?
Holy shit.
This is unacceptable. And this is what they're doing. And this is how they're justifying their lockdowns. Increase the testing at a test that's already known from the owner. Don't use it at that level because it's fraudulent. And by the way, it's not even really meant for that. That's Kerry Mullins. We heard from him. Anthony Fauci, anything over 35 is picking up dead nucleotides. It's not infectious, period. Okay, or very unlikely, I think he said. FDA document. It can pick up other viruses. So when people are saying conspiratorial, hey, by the way, hey, if you got the flu shot, man, like everybody likes to make fun. Oh, you got the flu shot, man, you can pick it up. And then they go, the heck with that. No, that's true, actually, because did you know that our flu vaccines, quote, look it up. Don't take my word from it. Look up coronavirus. They're using dog kidney cell lines in some of the flu vaccines, which dogs have a lot of coronaviruses, just so you know. So this is potential, but that even if it's not that, it could be also the fact that it's just picking up other viruses.
Not to mention, this year's the biggest flu shot campaign that Ontario has ever witnessed. And we were selling it. At my work alone, we were selling out in the pharmacy like every day for flu shots. like when we first
Well-
go, because they're free, right?
If you want the flu shot, take 2 from me.
I'm not getting one. I haven't got one in years.
All right.
You're like, oh, I gotta get my flu shot. I'm like, I'm not getting one. They're like, why? I'm like, because I haven't got one in years. Never been sick in years.
Well, I gotta catch up here. Is this the Files Ontario? Yeah, here we are. Oh, the wife's doing double duty, everyone. Baby in arms. She's a superhero. Okay, not my opinion again. Not my opinion again. We're gonna go over hospital definitions, ICU definitions, right from
Spot on, just well.
Public Health Ontario. Okay. Oh, it just keeps getting worse, everyone. Only case this is here we go. This includes persons with a positive detection of serum plasma antibodies to SARS, which was added to the confirmed case definition. So if you have antibodies now, you're also a positive case potentially. You don't believe me? Only cases meeting the confirmed case classification. You'll double speak. Only this followed by but this. This is what they do. Only cases meeting the confirmed case classification as listed in the MOH COVID-19 case definition are included in the report counts from CCM+. This includes persons with a positive detection of serum/plasma or antibodies to SARS-CoV-2, which was added to the confirmed case definition. Well, that's pretty shitty. I don't think that should be in there. Antibodies, does that mean you've already had it? Yeah, it does. Okay, moving on. The number of tests performed does not reflect the number of specimens or persons tested. What? The number of tests performed does not reflect the number of specimens or persons tested. More than one test may be performed per specimen or per person. As such, the percentage of tests that were positive does not necessarily translate to the number of cases or persons testing positive. So when they say cases, are they using the same thing? Are they using potentially the same person multiple times? Yes. The number of tests performed does not reflect the number of specimens or persons tested. More than one test may be performed per specimen or per person. As such, the percentage of tests that were positive does not necessarily translate to the number of specimens or persons testing positive. Wow. Wow. Hospitalization and ICU. Still in the public health document. Hospitalization includes all cases for which a hospital admission date was reported at the time of data extraction. What? Hospitalization includes all cases for which a hospital admission date was reported at the time of extraction. It includes cases that has been discharged from hospital. What? Meaning people that went home from hospital are also included in that hospitalized case count, as well as cases that are currently hospitalized. Emergency room visits are not included. Now, let me give a little bit of background on that one. My wife's grandma was in hospital. Even when she was unconscious, they were testing her every day for COVID. If she would have tested positive, she would have been a hospitalized COVID patient, according to that. That's literally what their data says. And now, when you go to the hospital, my mother-in-law, I guess, just went recently. Now, I don't know why she went in, but basically she went in and they said, well, it's not required, but we highly recommend you get the test. Now, if you were in there and you had to stay in a hospital bed for anything unrelated and you took a test and tested positive at 40 plus cycles or whatever they're running it at, hospitalized COVID case, according to their data. I'll continue. ICU admission. It includes all cases for which an ICU admission date was reported at the time of data extraction. It is a subset of hospitalized cases. It includes cases that have been treated or that are being treated in the ICU. You're already home? Psh, doesn't matter. You're part of the ICU for that day. Okay? This is what they're doing. And by the way, we're just going to make it seem like you have to get tested when you go into the hospital. And if you test positive, now you're hospitalized or ICU case regardless. Okay? Remember our article? Funeral worker. People aren't dying of COVID. They're dying with COVID. Sounding more and more true every day. Pop back over here. Is this the right article? No, it's not. I want this one. Now, there's a video in here. Who's that? This is, where is it? Manitoba. What's her name? Lynette Siragusa, the provincial lead of health system integration, was questioned about their hospitalized cases. Now, I'll let her words speak for themselves. Thank you to whoever this journalist was. Linked in here, I tell you where it is roughly in the video, roughly 52 minutes in.
I do not hear any audio.
You don't hear any audio.
No.
What?
No audio.
Hit the wrong thing.
You know what I like to know when I watch this is how much she's scrambling. She's like, I'm not ready for a hardball question.
Well, you can look at her. You know, she gets terrified. You can see her face. She's like
flipping through papers.
She's like, real question. Look. Like, who let this real journalist in? Look at that face. Okay.
Ms. Saragusa, what's the real ICU number today, including patients who are no longer infectious?
Well, there are... Sorry, Bartley, I'll go back to my notes. I think there's 105 patients in critical care right now.
In critical care.
She didn't even
All in.
All in.
How many beds? Which ones have COVID?
I think the last report I had was 10.
Hey, hi there.
Based on how you read body language,
Uh-huh.
what is she saying there?
Well, let's go back through. So for people that don't know, Broderick asked me that because it's one of my hobbies is to study body language. A great book for everyone to look into is What Every Body is Saying by Joe Navarro. He's a former, I believe, FBI interrogator who basically tells you what to look for with a lot of pictures. So it's a great picture book, which is right up my alley. And this, I'll just walk through it and I'll break it down. It's a 40-second clip, so it won't take me long.
Ms. Saragusa.
So you notice the difference here. He's more comfortable on the right-hand side, hands in front. She's got her arms crossed, which can be a sign of defensiveness, but it could also be a nervousness thing. But we'll continue.
Including patients who are no longer infectious?
Well, there are... Sorry, Bartley, I'll go back to my notes.
See the swallow? Yeah, she's nervous now. She didn't like that question. She's staring at the teleprompter.
There's 105 patients in critical care right now. So that's all in.
Okay. Now look at this face. She's like hoping he does not ask the follow-up. She's the lip up here. That can be a sign of I pulled one off or hoping for the best, contempt. But we'll see.
How many beds? Which ones have COVID?
See how she popped her head up? Like, did he really ask that? Didn't expect it, I don't think.
I think the last report I had was 10.
You see that the head down? That's almost like, in my mind, that's like a shame thing because she's being dishonest and she knows it. Huh? And the deep breath. Yeah. Like, so, I mean, you want to know what FBI agents and things like that will do. They'll break it down frame by frame and you need to understand different things. So it's not easy to make an assessment. You need to understand people's baselines and things like that. He's not comfortable after she says 10. Wow, let's go back. Just wow, my man. So,
Who's not comfortable?
She's not. The dude is like, yeah, I forgot about that. He's completely right.
Hey, hi there.
He pursed lips now. Yeah, let's amplify that. So you can see he's got pursed lips. It's kind of dark, but he's got pursed lips and he's creating a frown. She's looking over almost like for approval. And like, I'm sorry. She's kind of bringing the papers up almost to hide her face. And then you can tell like now he's leaning in and kind of like, you shouldn't have said that. Oh, yeah, it's good stuff, isn't it? That's good stuff.
All right, let's get back on track.
Hospitalization cases can be people that are in hospital or already home based on when it was taken. The baby's going, I'm sorry. ICU can be those who are in ICU or discharged, and then we need to factor in the type of testing we're doing, which is fraudulent, which is super high, can make anybody a positive, essentially. He's like, don't look at me. You said yep, pretty much. And so they were discharged, involved in deaths. Any positive is marked And basically, when you increase the testing and you're making people feel like they got to get tested when they go in, they could be going in for like a heart surgery and you're making them test. Now they got to get it done. Now they're a COVID positive and that's a hospitalized case per se. That's not me saying that. That's their definitions from public health saying that. Now, will they come out and say that outright? No. But will a journalist even ask the question to make them avoid it? No. So my wife's got to go get a baby that's crying. So
when you get false positive, when you need to get a heart transplant or something, and then you die because you couldn't get the heart transplant because you got a false positive, and then
there's all sorts of
COVID death anyway. So
man,
win-win for them.
So you got it on mine. Okay, that's fine. All right, sorry everyone. The wife's, we got a crying baby. She's avoiding the bedtime altogether. So I got to find an article in here. I'm gonna create. I got to add some code to the website to make it so that you can search the archive so that you don't have to do this because I'm getting tired of it. When I talked about that funeral article, this is the one I'm talking about. It's a great one. We had a whistleblower come forward, brave person, didn't want to give their name or location or anything else for fear of losing their job, but they still came forward. And for the record, if you have a story that matters, Diverge Media will do everything to protect your identity. If you're a nurse, if you're a doctor, if you're a funeral worker, if you're somebody on the front lines, if you're a politician, if you're a journalist, I don't care. We will do everything to protect your identity and get the word out on the things that matter because the people deserve to know. So sorry, everyone. I got to pop through here. This is another. I'm going to toot my own horn a little bit. Where'd it go? Here we go. This is our bombshell called Ontario Public Health. Got a customer service rep to admit that we run at 40 here in Ontario. And then we spoke with Rex Mohammed, who's media relations for Grand River Hospital. That's a good one. 11-minute phone call in there. All right. Masking. This tells you how to fake a pandemic. That's the article we've talked about from tonight. That's a great one. I wanted to pull up where the flu's gone too. Sorry, everyone. Man, you can tell I really need to put a search thing in here. Oh, this is driving me nuts. That's another great article that's gone right, wasn't really read that well. Canadian government's interim order, foreign vaccines to be tested in Canada. Basically, if it gets approved for sale in any other jurisdiction, government of Canada said, hey, okay, bring it on in. And we'll talk about that later tonight from another document that I think is going to concern everyone out of Europe from the European type journal. It's tied to the European Union journal, I think. Where's the man? How far back? How long ago did I write this article?
What are you looking for?
The masking one. COVID-19.
That was like when you were very.
Wow.
Yeah.
September 17th, I wrote this. Wow. That's like a while ago. Okay, so in 2018, this is why I think this is relevant to bring up. The Ontario, okay, I'll just read from it. Both prior and to and after introducing the policy of mandatory masking, hospitals continue to experience outbreaks of influenza. Imagine that. He concluded the evidence supported that masks do not prevent the transmission of the influenza virus. Now, 2 years prior, the mandatory mask mandate that had struck most of the world, the Ontario Nursing Association fought and won the mask argument in the court of law. The court decision reads like a manual today to the mask mandate that's being forced on the population. The court documents read, this answer to this question was no, and the association pointed to the report and evidence of masking expert Professor Lisa Brosseau. In her report, Professor Brosseau canvassed all of the relevant literature and wrote, it is my opinion that the surgical mask required for unvaccinated staff. This is what they wanted to do. You're not going to vaccinate, then you're going to wear a mask all flu season, 6 months of the year. At St. Michael's Hospital will offer no or very low level of protection from infectious aerosols, either for the wearer exposed to nearby patients or for the patients. So your whole argument was debunked in a court of law. 21 hearings they went through, 2 different appeals. Experts were called. They had to go through study after study after study. And you know what they said? Little or almost very low level of protection or no protection. That was their conclusion. That's what the court documents say. That's what the expert on masking, Professor Lisa Brosouth, said in her report. It continues. In particular, surgical and procedural masks did not prevent influenza transmission by an infected person. Now, Greg, it's not influenza, it's COVID. Okay? Aren't they both influenza-like illnesses that are spread through respiratory droplets? So you tell me how it's not the same. And on that topic, if the measures work for stopping COVID, or if the measures work to stop the flu, because that's another stupid argument being used. Well, the flu disappeared because of all of our social distancing, mandatory mask, and hand washing. Well, then why didn't COVID disappear? Because they're both influenza-like illnesses that are both spread through respiratory droplets and allegedly close contact. So you tell me, Doc. Not only do masks not, in addition to having filters that do not perform very well, the fit of these masks on your face will allow leakage around the side. Wow, it's almost like we've heard all this before. I know. So not only do masks not prevent influenza aerosols, COVID particles are smaller than influenza, a lot of aerosol leakage happens around the side of the mask, pushing any of the germs you may be trapping to areas on your face that are high touch zones like the neck, face, eyes, etc. Now, that was taken from the Ontario Nursing Association court document. Greg, I don't believe you. Okay, let's go to the ONA, and I'll read the same thing. Ontario Nurses Association has won a second decision on the controversial vaccinator mask policy, striking down the policy in effect at St. Michael's Hospital and several other hospitals that are from the Toronto Academic Health Science Network. These policies force nurses and other healthcare workers to wear an unfitted surgical mask for the entirety of the shift if they choose not to receive the influenza vaccine. 2018, only 2 years ago. Only 2 years ago. After reviewing extensive expert evidence. After reviewing what? Extensive expert evidence. Wow, I mean, they've already had extensive expert evidence in the court talking about mandatory mask use and their effectiveness. Wow, where's that in the media? Submitted by both ONA and St. Michael's Hospital, which was the lead case for the Tazen group. Arbitrator William Kaplan, in his September 6th decision, found that St. Michael's VOM policy, vaccinator mask policy, is illogical, and it makes no sense, and is the exact opposite of being reasonable. In reaching this conclusion, Arbitrator Kaplan rejected the hospital's evidence. A copy of the full decision is available here. On this note, I'm going to stop for a second here. I had a nurse argue with me. Okay, we go back, Kate?
Yes.
I had a nurse argue with me on that Ontario Nursing Association thing in a COVID group. I posted that. Well, it's not the same. That was her whole argument. Really? I understand it's not the same virus, but then can you explain where the flu went? And on top of that, can you explain why it's not properly isolated according to the FDA? Can we explain those things? And on top of that, they had to go through court, extensive experts and things like that. And on top of that, both of them are influenza-like illnesses. Both are spread through respiratory droplets. Both are spread through close contact, allegedly. So you tell me how that's not relevant to the discussion today. No answer, other than you're an idiot. Okay. They say what you want to say, but that's called cognitive dissonance, everyone. All right, back to it. Finish out. This is the second win for ONA, the Ontario Nursing Association. 2015, arbitrator James Hayes struck down the same type of policy in an arbitration that included other Ontario hospitals across the province, with Salt Area Hospital as the lead case. Hayes found there was scant evidence that forcing nurses to use masks reduced the transmission of influenza to patients. Despite the clear ruling, the majority of Tasman hospitals refused to follow the Hayes Award and maintained their respective vaccine or mask policies. As a result, ONA was forced to litigate this matter again at St. Michael's Hospital. The priority of nurses across Ontario is first and foremost the safety of our patients, but these policies do not protect patients, said ONA President Vicky McKenna, RN. Where the hell are you now, Vicky? ONA has already successfully argued against vaccine or mask policies, proving they are fundamentally flawed. Not my words, their words. And we are deeply disappointed that taxpayers' money has been wasted on having to do it all over again. Our collective agreement already protects our patients if the medical officer of health determines there is an influenza outbreak by ensuring that comprehensive measures are in place to reduce the risk of transmission to patients. The one pager, I'm going to read it all. ONA's well-regarded expert witness witnesses, including Toronto infection control expert Dr. Michael Gardam, Quebec epidemiologist Dr. Gaston Dessert, and Dr. Lisa Brazeau, an American expert on masks, testified that there was insufficient evidence to support the St. Michael's policy and no evidence that forcing healthy nurses to wear masks during the influenza season did anything to prevent transmission of influenza in hospitals. Both influenza-like illnesses, my understanding is COVID particles are smaller, so how is this magical virus still spreading with the mask that works so well? Well, 2018, they proved it doesn't do anything. Are marginal at best, according to the Danish mask study, 0.4% difference on 5,000 people. Okay, so it's marginal at best, which they've already said, or nothing. And here we go. They further testify the nurses who have no symptoms are unlikely to be a real source of transmission, and that it was not logical to force healthy, unvaccinated nurses to mask. That's what the arbitrator in court said. Arbitrator Kaplan accepted this expert evidence. Sorry, that was their expert said that. Arbitrator Kaplan, he accepted this expert evidence. In contrast, he noted the only fair words to describe the hospital's evidence in support of masking are, you'll like this one, everyone, insufficient, inadequate, and completely unpersuasive. Why isn't this being talked about day and night in the news? He also agreed with the ONA, that the Ontario Nursing Association, there was little evidence of any positive impact on patient care outcomes as a result of the vaccine or mask policy. Both prior to and after introducing the policy, hospitals continued to experience outbreaks of influenza. Sounds familiar. Still experience. We mandated masks. I thought they worked. Shouldn't this be done? Stay home. You're a piece of crap. Well, it seemed to work for the flu, so why is it not working for COVID? Shh. Shut up. You're an idiot. Conspiracy theorist. Tinfoil hat. Both prior to and after introducing the policy, hospitals continue to experience outbreaks of influenza. Concluded the evidence supported that masks do not prevent the transmission of the influenza virus. Well, it's not influenza. It's COVID. Yeah, you said that. Okay, that's not an argument. Influenza, COVID. UK actually lists them both as ILIs, meaning influenza-like illnesses, because they're both spread primarily through respiratory droplets. Both part of the coronavirus family is my understanding. So you tell me, okay, vaccine or mask policies have been highly criticized as being what? Symbolic rather than a scientifically based tool in the fight against influenza. Added McKenna. ONA has long advocated for the development of a province-wide comprehensive influenza plan that relies on credible evidence to protect patients. We are hopeful that with the second decision, remember twice they won, we can finally put this issue to rest and focus on the matters, what matters to Ontarians, the betterment of patient care. The union represents 65,000 registered nurses and allied health practitioner or professionals, as well as 18,000 nursing student affiliates providing care in hospitals, long-term care facilities, public health, and community clinics, and industry. Wow. I mean, okay. Are you convinced yet? Probably not, because you probably won't even tune into this if you don't already have an open mind. But I'm just showing you evidence after evidence after evidence after evidence after evidence. But don't you worry. The government's never done anything bad in the history ever. They've never conspired against their people ever. That's never happened. It's not a thing. COVID will be gone as soon as President Trump's. We'll see. Very low means immeasurable. You can't prove a negative, so you can't prove they don't work. Yup. Don't you love the doublespeak? I think your masking article was how I officially found this channel. Well, I'm flattered. Okay. Well, I got to go back to my notes here to see what I got next for everyone.
I remember Just Swall was one of our first viewers.
Yeah,
the whole time.
It's good to see like more people coming in all the time. I hope we keep growing, because ultimately I feel like we're bringing good, relevant information directly from the source that can inform Canadians. Like journalism used to do. Leave your opinion at the wayside and just inform Canadians. Let them make up their own mind. It was like this crazy idea. Wow, who does that? I don't know. I think it's the right thing to do. Okay, so the Danish random control trial. I have an article on that if I can find it. I have so many articles up here. This is the one. Producer.
See what Robert said? Yeah, but the pee meme with the pants, says the left. Have you seen that?
I have not.
If you pee on somebody without pants on, they're going to get wet. if you pee yourself with your pants on, then no one gets.
Well, you
get
tell
it.
the courts and the experts in the two hearings and the 21 the 21 different times they were in there on a like. You tell them they got it wrong. You tell them. I mean, the cognitive dissonance, and the only reason we believe lies, everyone, is because we want to. Okay, there's a hard fact for everyone. You're believing the government lies because you want to. Now, new Danish study finds masks don't.
Screen for a sec
What?
on how to find your.
Okay, so this is on the Danish mask study. Few issues are more contentious in modern life. Researchers in Denmark reported on Wednesday that surgical masks did not protect the wearers against infection with the coronavirus in a large randomized clinical trial. Wow, imagine that. 5,000 people roughly participated in that, and it was a 0.4% difference. I don't want to go through all of it, but yeah, here it is. Researchers had hoped the mask would cut the infection by half among wearers. Instead, 42 people in the mask group, or 1.8%, got infected, compared with 53 or 2.1%. Marginal at best. And now before the fact checkers, well, Snopes said or factcheck.org said, yeah, guess what? They might have said, doesn't matter. That's what the study said. And if you don't take this study, 2018, when they went to court with experts in the nursing, but that's not COVID. Okay, then you explain to me how they're spread differently. You can't? Okay, I thought so. Shut your mouth. Move on. So that's that. And then we wanted to show, this is an example of how they actually pop back and kind of walk it back. The editors of the Annals of Internal Medicine chose to publish the Dan Mask 19 trial because it is a well-designed study that provides an important piece of evidence to understand the puzzle of how to control the COVID-19 pandemic. Also note, Center Disease Control updated their guidance to acknowledge that masks, when worn by all, may. Notice this? But I read the American College of Physicians and it said it may reduce transmission. Yeah, may, meaning may not, may. Maybe it does, maybe it doesn't. Maybe all the evidence says it's marginal at best, 0.4%, and it's not a good enough reason. And that's presuming it's worn perfectly in the right conditions, changed all the time, handled properly, all that fun stuff. Yeah, but it may reduce transmission. You're killing grandma. I'm sorry, but everyone, I am just so freaking done with this narrative. Why is it being like this? Oh, you're going to be like that? Okay, well, I don't want to show it then. This is a New York Times article I can't pull up because I refuse.
But
you can look it up if you want to get it going, but it basically study questions whether masks protect wearers. Is that the one? Oh, I need to pull up the social distancing one. But yes, study questions whether masks protect wearers. It basically says you need to wear them regardless. No, it doesn't matter if it protects people. You need to do it because people feel like you need to do it. Okay. That's that one. I guess I got to sign in on Facebook if I'm going to get this up properly. It was there earlier. That's kind of frustrating. Sign up with an email. Okay, go ahead.
I think I have the ready for later. So don't worry about that one.
Oh, you got that one?
So that way you don't have issues with the New York Times.
Yeah. You want to pull it up then? Okay, and I got a video here. Okay. Now, well, we've already determined that. Oops, I got to pull the audio. We've already determined that it's marginal benefit at best. We've already determined that. Now, they will say, well, but it might protect other people and asymptomatic. So here's another big fallacy they built on. Okay? Less than 5% of people are known to have spread anything on the actual track, according to Dr. Maria van Kerkhoven of the World Health Organization. So you don't believe me? That's fine. Absolutely fine. Here is Dr. Maria van Kerkhoven. Now, she walked back the statements. Kinda, not really. And why she do that? Because there was a freaking storm from the media going, no, that's not good. Don't say that. My baby's fired up too. Here we go.
So there's a couple of things in the question that you just asked. One is the number of cases that are reported, that are being reported as asymptomatic.
Sorry, everyone. Come on. Now you decide to look. What are you doing?
So there's a couple of things in the question that you just asked. One is the number of cases that are reported, that are being reported as asymptomatic. And so we hear from a number of countries that X number, X percentage of them are reported as not having symptoms, or that they are in their asymptomatic phase, 60 days before they actually develop severe symptoms. In a number of countries, when we go back and we discuss with them, one, how are these asymptomatic cases being identified? Many of them are being identified through contact tracing. And so, which is what we would want to see, in that you have a known case, you find your contacts, they're already in quarantine, hopefully, and some of them are tested, and then you pick up people who may have asymptomatic or no symptoms or even mild symptoms. The other thing we're finding is that when we actually go back and say how many of them were truly asymptomatic, we find out that many have really mild disease, very mild disease. They're not quote unquote COVID symptoms, meaning they may not have developed fever yet, they may not have had a significant cough, or they may not have shortness of breath, but some may have mild disease. Having said that, we do know that there can be people that are truly asymptomatic and PCR positive. The second part of your question is what proportion of asymptomatic individuals actually transmit? So the way that we look at that is we look at these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're finding secondary transmission onward. Is very rare, and that much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data, and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward.
She's basically saying now she did hint at, because I already know what the other side of the argument is. Yeah, but you might not know you have symptoms. That's why. Okay. You got a cough? You got a run in the throat? Got the sniffles maybe? Just be a little more cautious. Asymptomatic, truly asymptomatic, run a high positive or high, like 40 cycle PCR test and you test positive. Very rare. Very rare. All right, you got the social distancing origin article? Roderick.
I had myself muted because of it. Yes,
Okay.
because of the echo.
Yeah, bring up a screen share. So we're gonna let Broderick take over here while I reorganize myself, and he's gonna go through the origins of social distancing.
I was just gonna scroll through with you.
Well, take it away, Tiger.
I read over this before, but I'm just
read
scroll through.
Read it through.
Okay. The untold story of the birth of social distancing. The idea has been around for centuries, but it took a high school science fair, George W. Bush, history lessons, and some determined researchers to overcome skepticism and make it federal policy. 14 years ago, two federal government doctors, Richard Hatchett and Carter Mesher, met with a colleague at a burger joint in suburban Washington for final review of a proposal they knew would be treated like a piñata, telling Americans to stay home from work and school the next time the country was hit by a deadly pandemic. Let's skip ahead a little bit.
The idea. Go to the third paragraph. Okay. I can take over. Sorry.
Okay.
I'm all organized now. Oh, go up a little bit.
Mm-hmm.
Yeah, that's good. Perfect. How that idea was born out of a request by President George W. Bush to ensure the nation was prepared for the next contagious outbreak became the heart of the national playbook for responding to a pandemic as one of the untold stories of the coronavirus crisis. It reported the key components Dr. Mesher, Department of Veteran Affairs, and Dr. Hatchett, an oncologist turned White House advisor, to overcome intense initial opposition. It brought their work together, and it laid out the concept of social distancing. Keep going. They're trying to legitimize it with a bunch of jazz on the top. Just give me the meat. Yep. Concept of social distancing is now intimately familiar to almost everyone, but it has first made its way through the federal bureaucracy in 06-07. It was viewed as impractical, unnecessary, and politically infeasible. There were two words between shut and up, initially said by Dr. Howard Markle, who directs the University of Michigan Center for the History of Medicine, who played a role in shaping the policy as a member of the Pentagon. It was really ugly. Dr. Mesher was there when Dr. Hadgett presented government public health experts the plan that the two of them and Dr. Lisa M. Coolin of the Centers for Disease Control reviewed over burgers and beer. People could not believe that the strategy would be effective or even feasible, but within the Bush administration, they were encouraged to keep at it and follow the science, and ultimately their arguments proved persuasive. Well, they're really going hard at trying to keep going. Down. Bush initiative. Down. This might be a pandemic is not like a forest fire. To develop ideas who had served. Keep going. A blunt-speaking, Chicago-born intensive care physician, Dr. Metcher, had almost no pandemic policy experience or expertise. Instead, he was recruited because they needed someone who understood how a hospital actually worked. Dr. Coonan, strategic out-of-the-box thinkers. Man, they're just like, it's a kid. A kid wrote this policy, and then their dad had connections to Bush, took it in. Get me to that part. Wow, making it sound legit or doing their best to do it. Doctor, yeah, here we go. Oh, here's the, no, it's all a doctor, Bush, government official, super smart. Okay, let's get to it. Dr. Glass's daughter, Laura, then 14, had done a class project in which she built a model of social networks. Oh, remember how I say they greenwash the crap out of any relevant information? There it is. Keep scrolling down. Oh, there. Pause. She built the model of social networks at her Albuquerque high school, and Dr. Glass looked at it, and he was intrigued. Students are so closely tied together in social networks and on school buses and classrooms that they were a near-perfect vehicle for contagious disease to spread. Dr. Glass piggybacked on his daughter's work. Yeah, my 14-year-old daughter, I think she's got a great idea. I like her school project, eh? What effect breaking up these networks could have on knocking down the disease? The outcome of the research was startling. By closing the schools in a hypothetical town, so we ran a model. In town of 10,000 people, only 500 got sick. Hypothetical model. Garbage in, garbage out. That's how models work. They remained open. Half the population would be infected. Oh, big ass. Mean they run a model. And he used his 14-year-old daughter's model to take it to the government goal. That's legit. And then they said, nah, we're not going to do that. And then all of a sudden, pandemic, COVID, let's do that. My God, we could use the same results she had and work from there, Dr. Glass recalled thinking. He literally watched his 14-year-old daughter's hypothetical model, and he got excited. You're like, yeah, I can take this to my boss. Thanks, I'm going to plagiarize your work, honey. Targeted, okay, right there. I just want that quote. Targeted social distancing strategies can be designed to effectively mitigate the local progression of pandemic influenza without the use of vaccine or antiviral drugs, concluded a study that Dr. Glass published. Based on what? I'd like to see that actual. I got to dig that up. But basically, he used his 14-year-old daughter's school project, ran it through a model of a hypothetical town, and went, this is great. I'm taking this to my boss. That's so fantastic. And that is where social distancing was born. All right.
There's something about the H1N1 in here too.
Oh, yeah. I haven't read that one fully through, but I'm sure they try to draw a bunch of parallels to play up how great it is. That's typically how this stuff works. All right, so we're going to go. I got a couple videos now, and we're going to go through a couple more issues involved with mandatory masking. Anybody heard of mask knee? Anybody heard of mask mouth, otherwise known as that was actually named mask mouth after the term meth mouth. Mandatory masking, everyone. Let's get back into it. A little short clip here. Nope. Next to that one. Not this one. Here it is. Yeah, you'd be in pain. Okay. Here we go. What is maskne? A dermatologist.
Just experiencing in general by wearing masks.
Yes, that is true. So the origin of the word maskne is obviously from the word mask and the word acne put together. But what you're experiencing can be, you know, an acne under the mask, but it also can be an irritation or an itching or a rash that's occurring under the mask.
So some of the questions that I've been seeing, it seems like some people are getting actual pimples, actual acne bumps, and some people are just showing that they're just getting, like you said, an irritation. So what would be, you know, the way to decipher the difference, I guess?
So really the issue that's happening is the occlusion of your face under that mask. Under the mask, dirt, oil, bacteria, makeup, if you're wearing makeup, can build up, and that can clog pores under the skin, and that can lead to this like acne picture. Either you're
Oh, now I can go. I was muted. Okay, so imagine that. You can build up dirt, other things like that underneath your mask, and that will cause outbreaks and irritation. And what about those people that are forced to wear them all day at work and then they get one mask for their entire shift? Do you think that's good for your skin? Nope. Dermatologist is telling you the exact same thing.
You're going to get these kind of deep white heads or blackheads, or you can even get more red or inflammatory acne bumps, or you could get kind of like a irritation, a redness or an itching on the skin. When you have that redness or irritation on the skin, you actually want to make sure you're not sensitive to one of the components of the mask that you're wearing, because I've been seeing a lot of what's called an irritant dermatitis or even an allergic dermatitis from either a adhesive or a material that is a component of the mask. So it's important to distinguish between those entities.
Wow, I hadn't even considered that maybe some of the components of the actual mask could be causing that irritation, but it makes a lot of sense because we're...
Wow, I didn't even think that the thing that was like not meant to be worn for 8 to 12 hours a day like could even do that. I didn't even think that it was a possibility that the thing I keep crumpling up in my pocket and then pulling out, you know, to use later could even do that. Wow.
We're just placing, I know for instance with me in the beginning, I was just ordering masks off of like Amazon or something and not thinking twice about it. And now I'm starting to be really picky about the mask since it seems like it's a long-term thing. So what would be, you know, things to look for, I guess, to try to decipher what's happening?
Yeah, so first let's talk about the acne or the breakouts that people are getting under their masks. So what you may notice is that your skin's gonna definitely feel a little bit more oily under the mask. You may notice that you're feeling like the mask itself is collecting some oil. And then you're gonna notice that you're actually clogging. Your skin is gonna start to look like it's breaking out. But the difference is gonna be that it's gonna be just under the distribution where you have the mask. So people who already have acne, who already have that oily complexion, they're gonna be a little bit more prone to this type of maskne because...
Wear it or you don't care about grandma, you piece of garbage. This is I mean, this is what they're doing, and it's just, oh, if you don't do this, you're this. If you don't do this, you're this. And they just put a name, attach a name. They don't talk about any of the actual issues behind it. And on top of that, doctors are refusing to write notes for an exemption if you have this over your face and you say it's causing me to break out. I know this because my wife went to seek one from her doctor who quoted this term. He introduced maskne to me. I didn't know that was a thing until he said it. He said, I know, I've been getting a lot of people coming in and I have maskne. And I said, okay, I hadn't heard about that before, but okay. And then sure enough, look it up, and it's actually so common. You have dermatologists talking about it because they're just being swamped and inundated with people that have that issue. Now, one more. We're going to get into mask mouth. Otherwise, derived from the term of meth mouth. Inside edition.
Real estate manager Jennifer Verbecki wears a mask all day.
My breath stinks.
She's not the only one.
Everybody's complaining about their bad breath.
Dentists say they are getting overwhelmed with patients complaining about what's being called mask mouth.
A lot of people with more inflammation, more cavities, more gum disease.
It's due to dry mouth, which happens when we try to get more air through a mask by breathing with our mouth instead of our nose.
It's hot. I feel so much better.
What can you do to avoid mask mouth? First, brush thoroughly. Then use a scraper like this to remove bacteria on the tongue.
Lovely. That's disgusting. I can't believe that just came out of my mouth.
But the #1 tip, drink plenty of water. Mask mouth, be...
Hey, don't fool with your mask, you're spreading COVID. Don't encourage that inside edition.
Gone.
Protect me from you and you from me. It traps droplets coming in and out of your mouth, which is how the virus is spread. But many people still wearing these incorrectly, which can lead to the spread of germs.
What does that say? We put this together for the record. It's not completely their edition. I put this in, I think. I don't think they'd be stupid enough to put this in. Do not wear a loose mask. Do not touch the front of the mask. Do not remove the mask to talk to someone or do other things that require touching the mask. Well, they're recommending that you do it.
People still wearing these incorrectly, which can lead to the spread of germs. One of the biggest mistakes is wearing it just covering your nose or your mouth. It has to cover both to keep you and others safe. Also, doctors say it needs to be snug to your face, not loose or baggy. Additionally, don't touch the front of your mask while wearing it. This includes taking it off to talk to someone. Doctors with Advent Health in Tampa say it's also critical that you have a clean cloth mask every single time.
Cleaning is very simple. It can be done in your washing machine with your regular wash. It's been shown.
But COVID, so all I need is Dawn dish soap and it's A-okay. All I need is some Tide and the COVID goes away.
Known to be very effective in taking care of the virus.
Dr. Ross also says start with clean hands before putting your cloth mask on, and single-use masks need to be thrown in the garbage after you use them. We have a full list of CDC guidelines and more information right from...
Good for you. Oh, man. Again and again and again and again and again and again. This just, are we done yet? Seriously, like how many different things do we need to go through before people wake up? That this is, you're not being told all the facts. They shut down the House. There is no debate. They will not talk about who is informing them on their health decision. They will not have a debate between dissenting opinions. But you think they have your best interest at heart. That's strange to me. Now, I want to bring in the mandatory mask on one other thing. It's running late, but I feel like I got to run through the gambit here. It's too important. Mask on effects on child development. Children scared. I have 3 personal stories. Neighbor kid, sweet kid. He is now scared of our kids, and they've been playing together for years. Now, his mom still comes around, a very nice lady. They still come around, but my wife noticed he was standoffish, didn't really want Grace to be near her, my daughter. And so that's one example. Now another one, my daughter, Addison, baby, young baby, I think 5-6 months at the time when we went out. We're in Walmart. Now she's looking at me and she's smiling, and Dad doesn't wear a mask. And she's looking at me and she's happy. And then she looks around, and I get emotional every time I think about this. Then she looks around and sees people, sees a mask, and she starts to tear up. She starts to get emotional, and I had to pick her up and carry her through the store. That's 2. Go 3. Mother-in-law was with the nephew, newborn baby, goes out to the mall with them. She wears the mask. The baby starts looking around and seeing everyone in mask and starts literally crying. She had to take off her mask to be able to comfort him. We got to stop pretending like the things we don't want to hear aren't true. There's enough evidence. There's more than enough evidence. Logic. We've just piled it on tonight. And there's 3 personal stories, and I'll give you another one. In Walmart, this is what we're doing to people, the fear. I had like a 19-year-old kid turn down the aisle wearing a mask. I'm not wearing a mask. He turned down, eyes were down, looked up, and literally went like this. And I'm not kidding, literally, and jumped and sped walked away. And I'm like, really, dude? And he literally like 180 spin back, gone. He didn't even get what he was there for. This is what we're doing to people. Can we at least have an honest conversation about what's going on? Can we have an honest conversation and debate? What do we got here? There's a little kid that looks so happy to see a smiling face in the Walmart yesterday. I usually avoid the mart, but it was a rare exception for me to go there, and she's 6. Oh, that brings up another story. Thanks, AB Free. In Walmart, last time we were out doing a little Christmas shopping. Go down the toy aisle, and like this 4 or 5-year-old kid comes up to us, and he's like, "Hey, check out my toy!" And he's showing it off, and the mom comes up, and she's like, "Oh, I'm sorry, but I think he's just really excited." Oh, God, I'm going to cry if I say this. I think he's just really excited to see someone's face. She said that to us. Mom and Dad were masked up, okay? And you could tell Mom was battling with it. She took the mask down to talk to us and thanked us for doing it. And her 2 children were there, and I just don't know what to do is what she said, but her child was thrilled to see somebody without a mask. Don't act like this doesn't affect children and their development. Don't act like this isn't the amount of times I've had to answer my daughter, "Why are people wearing a mask, Dad?" You know, some people do it because they think it's helping other people. Some people do it because they think it keeps them safe. We need to respect other people and love them anyway, baby girl. And this is what we're doing. You have people, the children, you think it doesn't affect them. I've had the personal experiences to back it. And people don't want the truth. That's true, Henry. And people
can't handle the truth.
People are believing lies at this point because they want to believe the lies. It is more comfortable to believe the lies. So we need to find a way to not. I'm angry tonight and I'm doing this, but it's because it comes from a place of care. I love people. I care about them, and I'm tired of seeing my fellow Canadian citizens terrified because of a fake narrative. Because they haven't been told all the information you've been told tonight. Because they haven't gone through all the research. And honestly, yes, there's going to be a lot that won't hear it no matter what. We need to find ways to break down the barriers. And it's not going to be done by pushing people's backs up against the wall. Don't allow yourself to be gaslighted. Canadians are Canadians. They need to know that you care. People don't care how much you know till they know how much you care. So that sounds like the best thing you could say to your dog. Thank you. Appreciate that. Okay. Now, another thing I've noticed on personal side, I'll let Broderick take over, and if he's got a personal story from there, we'll do that. And then I have one more thing, which is a COVID vaccine document out of Europe that should scare the crap out of everyone on that.
I think we were talking on the mask mouth thing.
Yeah.
My boss today literally told it's funny because I think they kind of ousted me on this morning. My manager saw me walking in with a coffee on. So for full disclosure, I, to make a living, work at Walmart, and I wear a mask at work. Only because I have to. Anyways, so I'm walking in, mask down, drinking my coffee, rushing into work. My manager sees me. And then we're in the back room in a meeting later, and they say, under no circumstances are you to be walking around with a mask down. Like, you've seen some associates walking around with coffee, drinking. And so they said you can't drink water on the floor, basically, is what I was thinking. Like, you can't even drink water, and I do it anyways. I'm always drinking water on the floor as much as I can.
Excuse to get it off your face, eh?
We're talking about that mask mouth thing with drinking water. One of those things. But, yeah.
Well, I'm going to ask you something because I personally noticed it. Like, I know, so people intentionally avoid eye contact with me now. That's probably the most common thing I deal with. I don't know how many times I've said it while I'm out in public, and I've literally said to people not under my breath, I've literally said to them, like, really, you can't make eye contact? And I just call them out on it as politely as I can, but it's like, man, like, stop treating people that you don't, like, are we that scared that we can't treat people like humans? Like, and a little eye contact goes a long way, and the small talk seems to be, like, it's just falling off the face of the planet. People don't want to talk anymore, for the most part.
I always make were you going to ask me a question there?
Yeah, like, what is it that you've noticed? People, like, for me, I know you kind of wear it at work, but, like, anytime I go anywhere, people intentionally avoiding eye contact. And
I know, like, I constantly see, like, when I see people in without masks on, I feel like even sometimes they're kind of skittish with people, like, even like especially employees and myself. and they seem to try to avoid you at all costs just in case you're going to confront them. And like, all I want to do is just be nice. And I know I've had some people ask me for help and they're not wearing a mask, and I go out of my way to be nice and kind to them.
I'll give you another one. The mandatory mask and COVID thing, keeping people from doing good deeds. Me, guilty. I'm normally the type of yeah, right.
Henry is right. Walmart is.
So I normally the type of person, if I see an elderly person like, putting stuff in their car, I would normally go over and offer to do it for them.
No, they're just scared.
I won't. Yeah, and now I won't do that. And I'll give you an example. Like I battled with myself the other day because I'm driving by somebody and she's like an 80-plus-year-old woman and her husband is in the passenger side. He's clearly not mobile. And she's there lifting these groceries in. And I'm like, oh, do I stop? Well, I don't know how she feels. She's wearing the mask. And then now we have nobody taking toy donations now, only gift cards as a result of this. We have Pastor Artur Pawlowski in Alberta, I believe it is, being told he can't feed the homeless. I mean, can we please acknowledge that these things aren't okay? They don't make sense logically. Like if the argument's, well, we need to reduce contact, then wouldn't you want every small mom and pop shop open for like diversity of options so that you could have less people in stores? No, let's shut them down. Go to the big box store. Okay. So I've noticed some of the staff seem to go out of their way to be more helpful than before when I ask for assistance. I think it's refreshing for a lot of people to see a smiling face. Absolutely right. And I noticed that too. When you intentionally go out of your way to, I always try to be friendly, especially now. I feel like it's a mission. And I've noticed, as much as it's a lot less people that will engage and be kind, I've also noticed the extreme amount of kindness from people almost compensating because they know. And so for those people out there, if you're that person at a workplace, just know you have no idea the difference you might be making in somebody's day, especially right now. Now I get emotional because I can think of days I've had that are, down days that were really crappy for me. And then I had a decent interaction with somebody at a store or something like that brought my spirits back up. It's so I got one more thing, but before we go any further, like we've covered a lot tonight. We've covered a lot of facts tonight. And I will say for me, the reason I'm, able to be as courageous as I am in the things I talk about is because of my faith in God. And that's where I come from, a place like we need to change minds. That's really why, I try, like the media, we're trying to just inform, but I'm ultimately trying to give somebody an opportunity to change their mind. An opportunity. And the reason I say that is because if you beat people over the head with the stick, they don't hear what you said anyways. And I feel like a lot of what's going on right now is people are so angry and the government's gaslighting it on both sides. And we have groups that are, tapping into that all over the world of just that undertone of anger. Like truth's on our side. We don't need to do that. Truth's on our side. We don't need to be in people's faces. In fact, we're actually doing ourselves a disservice to do that because people will stop hearing what you have to say. It doesn't matter how much you know until they know how much you care. We got to show them we care. And if we do, because we know it's the right thing. So, I caution people, please don't allow yourselves to be gaslighted by the media and gaslighted by politicians and gaslighted by people tapping into that undertone of anger. We need to step back. If we're going to truly change this narrative, like there's certain things, open your business, things like that, but we don't need to be fighting. That's the wrong analogy. We're fighting in a way. We're not there at all yet. And we need to, prove to people we care and we have all the facts to back it up. Have these conversations. Find ways to have these conversations with people that disagree with you. Don't make it a shouting match. Find ways to keep your cool on it. And I really believe the narrative will completely change. All the information's out there. I've tried to centralize it. Share this video out because I truly feel we've centralized all the information. We have multiple articles on our website that you can go through that touch on all these different things. We've mentioned them tonight. It is frustrating trying to wake people up, Henry. And that's where, a lot of my prayers lately are God, give me wisdom, give me understanding, and give me patience, and give me a heart for people, because I struggle, man. I just like, I struggle to keep that, the patience side and see, but I also know people are so afraid that I need to have an extra dose of patience. But we got one more document to go through. I said it was on the COVID vaccine, and then we're going to close out tonight, and I think that's more than enough. This is normally run, probably be done about 9:45, hour 15, hour and a half max. We're a little bit over that, but again, I said it was important information to get through. So I just got to find it here. Sorry. Old saying, if you ask God for patience, he'll put you in a traffic jam. Yeah. I like the, there's one that's, God will never give you more than anything you can handle. But if you're not going to listen to him, he'll bring you to your knees so that you start praying. I'm going to attend Artur Pralesky's church this Saturday. I've been meaning to start going to church, and I could take something positive for the government's becoming closer to God, well-defined government. That's great. All right. So this was the COVID thing I was talking about. It's concerning. It's extremely concerning. TED Tender's Electronic Daily. It's a supplement to the official journal of the European Union. This is in the United Kingdom, London. Software Package and Information Systems. I'll skip down here. Short description. 1.4 here out. Man. The MHRA urgently seeks an artificial intelligence software tool to process the expected high volume. They're expecting a high volume of COVID-19 vaccine adverse drug reaction, ADRs, and ensure that no details from the ADRs reaction text are missed. So they're expecting a high volume, according to this document. TED.Europe.eu, part of the supplement to the official journal of the European Union. Okay, so I think it's a decent one. And they're expecting a high volume of adverse reactions. Now, description of the procurement. The MHRA urgently seeks an artificial intelligence software tool to process the expected high volume of COVID-19 vaccine adverse drug reaction and ensure that no details from the ADR's reaction text are missed. So again, that's twice in two different spots. They've reiterated it. They're expecting high amount of adverse reactions from the COVID vaccine, at least in the United Kingdom. My daughter is crazy. Can I bring her over? She's like, All right. So I'm going to go through a few comments. Can you scroll through and see if there's some comments that are relevant tonight? I just want to make sure we don't miss anything. Hey, baby girl. This is my youngest daughter, Addison. She's the looks of the family. Does that taste good? She's teething. Yeah. How's that hand taste? All right. Frustrating. Okay, I really appreciate this. The friendly service amongst the negative vibes. Yeah, it makes such a big difference. What do we got here? In theory, anything is possible. Viruses are a theory. The facts are only further cement beliefs. Yes. Now, I think what just while I was talking about their virus theory, is it epizome theory? Basically, my understanding is like, listen, just because you have a virus doesn't necessarily mean that you're sick or going to get sick from it. In the case, an example of that is that you have cancer cells in your body that are inactive. It doesn't mean you have cancer. So that can apply to other theories, and it's being studied now. And virus theory is being questioned. Now, before you say, well, science says, keep questioning. All right, people who are forced to wear the mask all day are much more likely to catch something from the mask filled. Yeah, bacterial pneumonia, I think is an issue attached to it. And people say, no, that's not a thing. Well, if you're reusing a mask, not even reusing it, but 8 hours a day plus, but a lot of people are reusing them, and you're in a factory and you're in a dirty environment, you don't have the privilege of constantly shifting out, then yeah, you're going to be wearing a dirty mask and breathing that in. There's another video. Did you see this one, Project CO2? Okay, is that it? CO2 monitor?
Yeah, my mom got mad about that.
Yeah, she got mad. Oh, I don't care. But basically, the person put a CO2 monitor inside of the mask.
Measure the level of oxygen.
Yeah, the oxygen?
Yeah. So if the oxygen levels were too low, it would be.
No, it'd be the CO2 levels.
Measuring oxygen.
Okay, I don't know. I'm not going to include that then because I'm not understanding the. Oh, hi. I'm not.
It was linked in our newest article.
Okay, so it's linked in our. Really?
Well, no, somebody commented with it.
Oh, it's on our newest article. Somebody commented that link, so check that out.
Newest meaning the one above, second newest on the website. Nah.
Yeah. You're crazy. What are you looking at me like that for? We got another one here. Wear your mask between bites. Yeah, that's got to be the greatest, right? And then it's like we remember don't tamper with your mask. Like, unless you're going to a restaurant, then you need to tamper with your mask in between bites. So sorry, I'm just getting my wife to go through the comments here because we don't usually get. It's like a diaper rash. Yeah, that was the on the. Hey, I was on the mask. And I love. Hey, I love you too. So I want to show. You got another one here.
Yeah.
We're good. Okay, I want to show one more thing. If our audience here could share this out from the. Is this our Facebook? Yes. Could share this one out from. Get it off. Sorry, everyone. This is if you can share this one out. This is what we talked about tonight from the FDA. This is the one on the test cannot rule out diseases by other bacterial or viral pathogens from the FDA. Published yesterday at 7:39. Easy there, Tiger. And that would be a good one to share out because I mean. It's just little things. We need to pepper the narrative with truth. Do it out of love. Do it out of kindness. And what? All right. She has that effect, AB Free. She has that effect. But she's supposed to be in bed an hour and a half ago. That's the face of success. Get the tongue back in there. Anyways, do you got anything else for us, Broderick?
I don't know.
No? All right. So if anybody's got any questions, I'll wait a few seconds. And if not, we're going to close off for tonight. All right. I think we're good. Everybody, thank you for tuning in. Diverge Media does our live streams Monday and Thursday nights, 8:30 p.m. Eastern. If you can afford to donate, it would be greatly appreciated. I'm on parental leave currently, and I'm due back at work in a month, trying to make this a full-time gig. If you can do that, that would be great. If not, we do have. Oh, that was one thing I meant to do. Is that on the? It's on the website, right, Broderick?
Yeah. So, it's divergemedia.ca/shop. I think it is.
We have merch coming in. We have a hat coming in. It will be here just before Christmas. We can take pre-orders on it. We literally only have 8. So 8 at $30 a pop, plus shipping, or we can run it out to you if you're in the GTA. But basically, our plan is actually as we ramp up and get more merchandise, I'm actually going to drop the price on those because I don't feel that's a great spot. But as is, like that's not. I think it's a $7 profit margin. It's not much, but it's more about getting our something out there with our logo and name on it. Sorry, I'm just going to pull it up. Stop pulling that way. What's there? Okay, so not that one, not that one, this one. So this is basically what the hat's going to look like. It's a snapback. We got it listed at $29. Well, it's $29 then because I'm not going to go back on my word. Right, so here's your backing. It's just a little mesh back. And it's going to be that logo on the front. But yeah, simple, clean. I'm going to get one. Broderick's going to get one. And we only have 8 available after that. Henry, I'll take one. That'd be great. Yeah, just shoot us a message. We'll take
it says to e-transfer them for them to pre-order kind of thing. But I think what we can do is if you live in the area, we can even deliver it by hand. If you live close to us, you can email us about that. But if you live out of town, out of city, we still haven't figured out the whole payment methods with the credit cards on the website, and I don't even know. We can look into that, but
yeah, if somebody can guide us down that, help a little bit. I have a friend who does web design. I'm just too lazy to not too lazy, too busy these days to figure it out anymore.
It takes hours and hours, right?
Hours and hours, and we'll get that figured out. For now, we'll take an e-transfer on it. And basically right now, I wouldn't even ask that. What we'll do is just in case something happens with the merch, there's a delay. I know they're backed up like crazy and we only put in an order of 10. What we'll do, just send us a message, say, hey, I want one. And we'll put your name on a list and then we'll contact you when they come in and we'll go from there. That's a good looking hat. I like to go. That's great. That's all the way out in Alberta. I hope it's not too much for shipping, but we'll figure it out. Again, yeah, just shoot us a message on Diverge Media's Facebook page. That's probably the easiest way for us to centralize it. Hey.
Or just email divergemedia@outlook.com.
All right.
Yeah, they're estimated to come for the 17th of December. Like, be ready. So
yeah, so we would make sure they were out before Christmas, and I don't care what the government says they're doing, but we'll make sure they're out before Christmas. That whole inter-province stuff, though, that's a different story. I can't promise that, but if you're local, we'll make sure it gets out to you. And I appreciate everyone tuning in tonight. Please share this out. I really feel like this is a great one to share out. I know I was pretty feisty for most of it. But again, it does come from a place of love. We need to find ways to get this information to people and let them know that we care. And it's because we care that we say these things. Like, our economy can't crumble. We can't let business be destroyed. And we have to do what it takes to protect our future for our children. You've obviously put hours and hours exposing some major stuff, so I appreciate that because honestly, it's lost on people how much work goes into it. There we go. All right, everyone. Greg Saley signing off from Diverge Media. Thank you for tuning in.
Have a good night.